Welcome to Perfectly Planted Podcast. I'm your co-host, Besame Schwering. If this is your first time joining us, thank you for spending your morning with us. If you are a Perfectly Planted part of our community, we really appreciate you and thank you for continuing to support our journey and our messaging and spending time with us today. Daphne, good morning.
Good morning, Besame. I want to echo Besame's words of gratitude and thanks, especially coming off of this Thanksgiving holiday. I hope you all had a wonderful holiday. And we started this podcast in our blog and our website to plant seeds of positivity, knowledge, and empowerment. And we're so happy that you're able to join us today. Besame, talking about the holiday, how was your holiday weekend?
It was wonderful, Daphne. I mean, we tried to keep it simple, a little less chaos, but it was really a much needed break from the day-to-day and spending time with family and really treasuring that time. I hope you had a great holiday weekend too.
I did. It was nice and quiet, but I was reflecting earlier that we shouldn't just wait for Thanksgiving to give thanks.
Right.
So definitely thankful for all I have and all that I am blessed with and able to give to others, and trying to remind myself to do that every day, not just on Thanksgiving.
That's right. No, and I'm actually very thankful and grateful for our guest today. I'm really excited. I'm going to introduce Dr. Daniel Ganu is our guest today. He is an associate professor of public health at the School of Postgraduate Studies, Department of Applied Sciences at the Adventist University of Africa in Kenya. He earned his undergraduate degree in theology and health science from Andrews University in Berrien Springs, Michigan. Dr. Ganu, superstar, global superstar, I have to say, earned his Master of Public Health and Doctor of Public Health degrees from the Adventist University of the Philippines. He served as a senior lecturer and the Dean of Academic Administration at the Valley View University in Ghana. He also currently serves as the Dean and School of Postgraduate Studies. Daphne, I know you had the great fortune of meeting Dr. Ganu at the International Conference on Nutrition in Medicine in DC, and Dr. Ganu had traveled to the conference to learn more about the value of nutritional intervention and to prevent and reverse chronic diseases. You may have also heard his incredible interview on the Exam Room podcast. If not, please go check that out. It was very inspiring. We will post a link to that. And Dr. Ganu, welcome, and thank you for joining us. I know it is in the evening in Nairobi. We really appreciate your time today. We really are excited to hear more about your health journey. And what has gotten you to what I learned in the Exam Room podcast was just inspirational, and hoping that you could share some of that with our viewers today as well.
Thank you so much, Vasami, and thank you so much, Daphne, for having me in this podcast. I'm so grateful and I'm so excited to interact with you.
So, Dr. Ganu, can you tell us a little bit about, I know we had the pleasantries of me being able to share with you and you being able to share with me what brought you to DC and a little bit about your health journey in general. But could you share that with those listening and watching?
Thank you so much for the question. Like you have rightly said, my name is Daniel Ganu, and I am from Ghana. I hold a doctorate degree in public health, specializing in preventive medicine. I work as a university lecturer currently in Nairobi, Kenya, where I currently reside also. My plant-based diet journey had a history and a reason. It all started in the year 2000 when I developed a severe form of rheumatoid arthritis. This disease became so much worse that I was put on several medications, including steroid called prednisolone. The disease showed no sign of slowing down, irrespective of all the medications that I was put on. The pain became unbearable, and I also started seeing some side effects of my medication. My condition got worsened, which led to the development of what we call systemic lupus. I was put on daily heavy medications, but I realized that my strength was diminishing in terms of function. In other words, my energy level is depleting all the time. It is a long story, Daphne and Vasami is a long story. But to cut the long story short, my wife was very much worried and always looking for solutions for my condition. She came across Chuck's interview in 2021 with the physician committee involving one medical doctor, a cardiologist, of course. And this medical doctor had the same condition that I had, rheumatoid arthritis. And then the doctor indicated in the interview that she overcame her condition by practicing a plant-based diet. So in October 2021, I started practicing a plant-based diet, but not completely. I once in a while take in some fish, egg. But then in January this year, 2022, I switched completely to a plant-based diet. Within 4 months, Vasami and Daphne, within 4 months, I started seeing dramatic changes in the inflammation of my joint. The pains now became manageable. The pains continued to vanish. I started cutting down on my medications. In August this year, I reduced my methotrexate dose from 6 tablets per week to 4 tablets per week. As I speak to you right now, I have reduced it to 3 tablets per week.
Great.
And the pain is no longer there.
Yeah.
My goal is to totally get off all my medications by June next year. And that was the genesis of my plant-based diet. And that was my story in a summary. If I were to enumerate the details of my story, it will take us a long time. Yeah.
So I understand it that you have created or you have a vision for a lifestyle center. Do you want to share a little bit about that?
Yes, Vasami. I know I am a preventive specialist myself, but somehow, and I will say again, somehow, this plant-based diet thing, got hidden from me. And so when I discovered that it has done something great for me, I am willing to quit my profession, which is a teaching profession, and return to Ghana and set up a center of influence for lifestyle management and research. It is time to turn to Africa. Many Africans are innocently dying and are suffering from chronic diseases. And I want to be a blessing to them, especially to those in Ghana. So I am holding to that vision, and it's a vision that I'm so much passionate about. And I pray that I'll be able to reach my vision.
I love that. And I know that with this lifestyle change, it was your amazing wife who actually started to help
say that
your
with me.
initiative, with starting that whole food base. So how has this whole food plant-based diet impacted your family? And if you could share any favorites that you all have learned through your journey, and something that has been a staple in the food and what you prefer to eat.
Yeah. Thank you so much for the question. This plant-based diet has changed our diet as a family drastically. Let me share with you a typical menu for me during the day. And I intentionally stick to that. In the morning, I usually eat raw salad made of different types of vegetables, such as carrots, lettuce, beetroot, bell pepper or sweet pepper, olives, baby spinach, and we can continue. My wife usually prepare those and mix them together, and I love that. Every morning, that is my breakfast. I would just add some few tropical fruits like papaya. We have a lot of tropical fruit here: banana, oranges, and so on and so forth. That is my morning breakfast. First of all, I just want to echo that I do not eat processed or refined foods. And I eat my heavy meal in the afternoon. So, and the heavy meals are mostly our local Ghanaian dish. You may probably, if you Google, I'll mention the names. If you Google them, you will see some of these local Ghanaian dish. Some of them are, we call it fufu.
Fufu.
F-U-F-U, yes. Fufu is made from plantain and cassava.
Yum.
And it's a delicious one. It's one of the staple foods in Ghana. And then I also eat yam. I don't know if you have come across yam before.
Yes.
Yes. And then we have plantain.
Yes.
Very good. And then banku. Banku is made from corn, fermented corn. And then rice and beans and so on and so forth. So these are local dishes that are not polished. They are not refined. They are not. And then my wife makes a beautiful lunch out of this food. So typically that is my lunch. And my dinner or my supper is mostly fruit. Sometimes I do not even eat supper.
Okay.
My lunch is heavy. So supper, I tend to forgo supper or take in some fruits.
I appreciate you mentioning the whole food plant-based, because I know here in the States, vegan is a buzzword now. It's a trend. And oftentimes that trend goes to the big manufacturers of processed foods to start to market things like vegan, plant-based, whatever. But it's very different to be whole food plant-based, as you said. So it's not processed. It's not out of a box. It's not something that you actually, is ready to eat. It's something that you do cook and prepare yourself to enjoy. So thank you for doing that, because I think oftentimes people think, well, I'll just go vegetarian or vegan, and then they end up eating a box of crackers. It's like, that's not the way to do it.
It doesn't help,
That's right.
Yeah. As a matter of fact, I am a professor, a university professor. If you take a grain, let's say a corn, for example, the corn has the cover, which is full of fiber.
Yes.
Once you polish or you process it, you remove that cover. And then see the germ. The germ is where the corn can germinate from. That has a lot of vitamins and minerals. And when you polish it or when you process it, You remove all those vitamins and you remove all minerals. So what is left is the endosperm, the white, corn, which is, we call it a naked carbohydrate. That's the word, naked carbohydrate. So processed food, when you are a vegan or plant-based diet person and you tend to eat processed or refined foods, you are not helping yourself.
And Dr. Ganu, it's funny because you just reminded me of all the biology that I had forgotten about.
I love it.
Yeah. But going back, I mean, you are a university professor. You have a focus on prevention, and yet no one ever mentioned plants in a whole food, plant-based lifestyle as an option to help you manage your disease.
Yes.
Where did we go wrong? Because, I mean, you've been treated in multiple countries too.
Yes, you are right. I was treated in the Philippines, in Ghana, in Kenya. The problem, let me begin this way. Like I said, I am a preventive specialist, and I work with 4 levels of prevention. The number 1 level is called primordial prevention. Primordial prevention deals with preventing the development of risk factors by us taking care of our social and environmental conditions. We don't want the risk factors to even show up primordial. So we take care of those things that are in the environment that can help bring up those risk factors. We take care of them. That is the first level of prevention. The second level is primary prevention, which is preventing the occurrence of diseases by taking care of by modifying the risk factors of the disease. So in other words, the primary prevention is we don't want the disease to occur. We try all we can, prevention of occurrence. The key word is occurrence. But then the next level is the secondary prevention. The disease has now come. We failed to prevent it. The disease has come, but we do all we can to prevent the progression of the disease. The key word there is progression, secondary prevention. Then the last level, which is the 4th level of prevention, is tertiary level of prevention, which is the disease has come, the disease has progressed, but we try all we can to prevent disability of the person. Vasmi and Daphne, your question is, how can we redefine health?
Yes.
I think that is the question you're asking. How can we redefine health care instead of waiting to treat the disease?
Exactly.
Yeah. If the problem is, if only our healthcare delivery could focus more on the first 2 levels of prevention, which is primordial and primary prevention, we could overcome many diseases. See, I am a Seventh-day Adventist. Seventh-day Adventist. In the Seventh-day Adventists, we have a lot of health research, and the problem also has to do with behavior. Some of these things, I know them, but not until I am faced with some of these conditions, I was adamant. I knew some of these things, but I need encouragement. I need people to empower and to encourage. And that is what people need. People have knowledge, but we need to remind them and to draw their awareness, like you are doing right now, over and over again. And so the problem we have right now is that medical doctors, much depend on medical doctors. Medical doctors are now focusing on secondary prevention and tertiary prevention. And that is where the money is. The medical doctors and the pharmaceutical companies have become, or they have diverted the attention to where the money making is. And
That's
that is
right.
the problem we have now. Yeah.
I was listening to a different podcast, and they're talking about how, there's also personalized medicine as well, and it's also all encompassing across everybody. And what happens is, physicians, traditionally trained physicians are, somebody comes up and says that, I don't feel well when I eat sugar or so, whatever it may be. And they just get out their prescription pad to issue out, write a prescription. So I appreciate each of the levels. And so it's that preventative, it's that continuing to treat and prevent. And then it's also, let's not get to the tertiary level, but when we get to that level, because sometimes we were treated to get to that level, essentially, how do we then, treat it, but then also treat it so that it continues to be preventative, does not progress. And you're living a lifestyle much like you are, where you don't have pain from your arthritis or lupus, so that example is so inspiring to me when you have shared that. Thank you.
Okay.
And so Dr. Ganu, and I want to thank Blind Guy, his wife, and their life, who's listening live with us today. Yes, we agree that the incentive right now is to treat disease, not prevent it. So what are you doing in terms of how are you advancing this locally in Ghana, in Kenya, in order to shift that? Because I know that, and we talked a lot about this at the International Conference on Nutrition and Medicine, and ACLM talks about this, but your primordial and primary prevention are key. And whether you're talking about food or physical activity is keys to preventing disease. How do we put this in front of pills when there's no financial incentive related to either of those, as opposed to a lot of the disincentives to address primary and primordial root causes of sickness, that there's no place in the healthcare system for that to really be driven from, except from people like you.
Thank you so much, Daphne. What you and Vasame are doing, you are doing, I will say, sacrificial work on behalf of humanity. I don't think you are being paid like medical doctors, but a lot of people will listen to you, and this podcast and many other podcasts you have made will have life-changing influence on many people, and yet you are not going to be paid for. So what we are doing it for humanity, and we are doing it for God. If you really want to make the money, go to the medical school, get trained, and focus on secondary prevention and tertiary prevention, where you will treat people and get money from them. And then you also get money for the pharmaceutical companies. But, like I said in the beginning, I have a new passion and a new dream. And it's all emanated from people like you, and then my condition. In fact, I am deeply passionate about this new dream I have. I have been in the academia teaching all of my life. My new passion now is to quit my teaching profession, and I want to return to Ghana and establish a center of influence for lifestyle management and research. It may not be a money-making venture, but if I had not met people like Chuck, who interviewed Monica Agawal, I would have died. I would have been crippled. Why can't I do that for humanity also? And in Africa, we are still fighting communicable diseases. tuberculosis is still there, diarrhea, cholera, all of them are there. And yet we are adding non-communicable diseases, making it a double burden of disease for us in Africa. And I can tell you that many Africans are suffering and are dying innocently. What they could have prevented if they know or if they have the knowledge. See, the aim of this lifestyle that I would like to set up is to educate, is to prevent, is to research, is to manage and reverse chronic diseases, and advocate also for policies that will help in minimizing and reversing some of these diseases. And I'm glad I have friends like you, people which I can collaborate with and make this dream come true. And I'm really very grateful for the time like this that you have given me to be able to verbalize my passion and my dream. And that I'm so grateful for. Thank you.
Oh, thank you, Dr. Ganu. As we wrap up today, I know you've shared a lot and a wealth of knowledge right now. Thank you. Is there anything else you would like to share with our audience and our viewers and listeners today?
Yes. What I would like to say is that I will echo what our former President Obama said. A positive word of encouragement. He said, yes, we can. And I also want to say that, yes, we can do it. I never thought I could practice a plant-based diet, but I am gladly doing it today. I will encourage people out there to start gradually. But then the key for their success is self-discipline or self-control. But then plant-based diet is one of the diet that we can never downplay. It is one of the best diet if we can practice it very well. It can, the nutrition is a medicine. It can also become your enemy. It can also become your enemy. So I just would like to say again that, yes, those of many people out there who would like to practice plant-based diet, the key is, yes, we can. Self-discipline, self-control.
I love that.
Yes.
And Dr. Ganu, you are so correct. And I also want to give a call out to one of our listeners and watchers. So Blind Guy, his wife, and their life, who is a newly minted Food for Life instructor. So you are we can't thank you enough for all you're doing. And I want to ask how we can help. We collectively, Besame and I, those listening, how we can help support your journey, but also know that there are people like the Food for Life instructors who are in the community, who are helping provide education and empowerment and knowledge to community members globally around how to introduce and how to become plant positive in terms of taking those small steps. But what can we do to help you on your journey? And when can we expect to have you back on so that we can get an update about all the wonderful work you're doing? And where can people reach out to you to help?
Thank you, Daphne. In Africa, I don't want to say that money is a bit of a problem to come by. And if I want to set up this center of influence for lifestyle management, I will need some support and all collaboration. I'm now raising funds, but I am setting up my landing page very soon. I am so grateful for my good friend, Du Bois, Matty, who is so instrumental helping me to raise some funds to set up this center of influence, and it will be a center of influence for Africa. In US, you have many of these center of influence, but in Africa, we don't have.
Yeah.
At least we need a decent one for Africa that can help the Africans. So I will probably give my details to you and my website and my social media handles, and anybody who would like to help probably can help. And thank you for asking that. Thank you so much.
You're welcome.
Yeah.
Dr. Ganu, thank you so much for joining us. This has been extremely inspiring. And also, as Daphne said, we would love to have you back to learn more about the progress and also get educated a little bit more from a professor. So thank you so much. It's been really fantastic to have you. And I know it's late in Nairobi. So again, thank you for your time. And once again, thank all of our viewers and listeners for joining us for another Sunday Seedling. If you're enjoying Sunday Seedlings, please feel free to share with your family and friends. If you would like to subscribe, you will get notifications on when our next podcasts are loaded, like this one with Dr. Ganu. We hope to hear from you on our comments and blogs. We appreciate, like Daphne said, from the blind guy, his wife, their life. Thank you for listening. And we'll continue to monitor our comments and really enjoy the collaboration. Thank you all so much for joining us.
Good. Wonderful. Thank you so much for having me. Thank you.
It's been a pleasure. And hopefully someday we'll be able to come see you in person.
Please, you are all welcome.
I would love that.
Ghana is your home.
Perfectly planted road trip.
There you go. That's right. On site, on location.
Good.
Take care, everyone.